Good evening, and welcome to this week's Thinking Thursday. Well, actually, Black mental health is mental health, formerly Thinking Thursday. Tonight, our topic is just what is psychotherapy? We talk about going to therapy, and I even recommend on this broadcast if things are more than you can handle, seek a therapist, seek help. So, what does that mean? I find a lot of people don't really even get it, don't understand, or because it's so scary and so mystified that the thought of seeking help, seeking therapy is more than people can manage. So tonight we're going to talk about what does that mean to seek therapy? How difficult is it to seek therapy and is it for you? So tonight we will find more and more about this thing called therapy. But as you know, before, if you've been here before we begin, we are going to start with some deep breaths. Why? If you've never been here before, let me tell you why. Deep breathing is cleansing. It will allow you to decompress from your day. It can allow you to just relax, and something we all need to do. So, I want you to take a moment to just do some cleansing breaths with me. If you've never done that before, here's how you do it. I want you to lightly put your hands on your stomach. Why? We're going to breathe in so deeply that you're going to feel your stomach expand because you're not going to breathe just to your chest. You're going to take a deep breath and fill up the bottom of your lungs. I'm going to count to 4, breathing in, and 4, breathing out. And you'll have a chance to do that with me. So let's practice. So breathe in, 2, 3, 4, out, 2, 3, 4, in, 2, 3, 4, out, 2, 3, 4. One more in, 2, 3, 4, out, 2, 3, 4. Well, I hope that has allowed you to calm and be centered. And I recommend you do this anytime your day is a little stressful. Just stop. Take a few deep breaths. Allow your mind and body to woosah. So tonight, we're going to talk about just what is psychotherapy. So I have a few questions I'm going to answer. Like, what is psychotherapy? What are some of the advantages? Does it really work? What does the research say? Um, who does psychotherapy? What are there's different professions. What are they? What are the differences? What are the different models of psychotherapy? What does it cost? Um, and how do I find a therapist if I finally decide that's what I want to do? So let's talk about what is psychotherapy. Well, people talk about it as talk therapy, and it's a way to help people. It's more than just talking, though. The therapist or psychologist or even psychiatrist, and we'll talk about that later on, are trained in different ways to help you manage whatever is troubling you. So, psychotherapy helps people with problems in their daily life. And it could be anything from dealing with the impact of trauma, it could be grief, it could be serious mental health issues such as psychosis or schizophrenia or grief or anxiety, depression. Any of those issues and more can be dealt with in therapy and can benefit you. So, are there any advantages to therapy? Let me think about a few. I jotted down some, so I'm going to look at my list. One of the things you can learn is better relationship skills. Some people enter therapy just to work on relationships. Couples come in, there's couples therapy, and they want to work on their relationship. Or some people want to work on just relationships in general. You might realize, every relationship I'm in is an abusive relationship. Maybe I'm doing something to attract an abuser. Or I just need to be a better person at my job and I need to deal with how I manage work relationships. Another thing that another advantage is understanding and helping you achieve personal goals. Sometimes we're our own worst nightmare when we get in our own way. So, coming to therapy can give you the opportunity to work on your own personal goals, or maybe even figure out how to set goals. Maybe it's, I don't know what I want to do. I don't know. I just don't know. So, therapy can help you work on your own personal goals. I've talked before about the relationship between physical health and mental health. So, another benefit to therapy is helping you overcome depression or compulsive behaviors or manage an illness. People who have serious illnesses often become depressed, often become despondent, hopeless, experience anxiety because of the illness. That can be a reason to come to therapy. People with cancer. How do I manage life with cancer? How do I manage the fact that I have cancer? How do I manage? I watched a webinar this week about depression and diabetes, a strong correlation. How do you manage those two? So, coming to therapy can help you work through some of those. Sometimes people are coming just to boost their self confidence, their self esteem, their sense of self worth. They've lost it. And if that is the case, there are probably some other underlying issues. And coming to help therapy can help you figure out what are those issues? Why do I feel so bad about me? You're the only person that's with you all the time. So, man, it helps to feel pretty good about who you are. Definitely, it can help with your overall mood. We talked about depression, anxiety, grief, dealing with those mood or serious mood disorders. It can help you do that as well. Therapy can also help you replace negative thinking with positive thinking. It is so easy to get caught up in negative thought. And it goes to feeling bad about yourself or just having a negative view, the Debbie Downer, all you see is a negative. Coming to therapy, that can be something you address and can help you look at the world in a more positive light, can help you understand why do you see only the negative. Um, we do the deep breathing in the beginning. Part of your therapy might be learning to relax, and that might be part of your therapeutic intervention to deal with just some relaxation. Goes a long way. So you wonder, the next question I want to answer, does therapy work? Well, of course, I'm going to say yes. I'm a therapist, so I wouldn't want to do anything that didn't work. I wouldn't want to spend hours a day on something that didn't work. But yes, I looked at research and statistics, and about 75% of people who enter psychotherapy show benefit from it. Psychotherapy has been shown to improve emotions and behaviors, and it's linked with positive changes in the brain and body. Back again to that brain body connection. So once you're in therapy, um, some people also, studies show that people who are in therapy have fewer sick days, less disability, fewer medical problems, and increased work satisfaction. Why? You are learning to manage your overall life better. I believe in that mind, body, spirit connection. So when you're more aligned, you're handling the negative issues in your life or the issues that you just haven't been able to manage, you're handling them better, then you're better to take care of your physical health. We talked about a minute ago about diabetes and depression. Well, you've got to treat them both because when you're really depressed, it can impact your um, depression greatly because and then when you're too depressed, You won't want to take care of your physical health, so you're on that wheel. I'm depressed, so I can't deal with my physical health. I can't deal with my physical health, and now I'm depressed. Oh, now that I'm depressed, and it just goes on and on. So coming to therapy can allow you to learn to manage both, because you really have to manage both just to you just gotta figure it all out, and you can't by yourself. So coming to therapy can help you. Um, so that's how it can help with medical problems, because once you are in a better mind space, you are better equipped to handle whatever the medical problem may be. Increase work satisfaction. I have clients who come because I hate my job. I can't stand my boss. The people in my job are this. Um, so many different issues. You can come and kind of work through them. Um, and maybe the job is a problem, maybe you're the problem, maybe it's a little of both. But yeah, figuring out those issues, it can make your home life better. Not just because, even if you're not necessarily having a problem with your mate, but if you're the unhappy one, well, it's going to impact your communication. It's going to impact how you just see life. If you are depressed or you're just in a blah mood all the time, don't you think that would impact how you see the people around you? So, managing your mental health, those are some more benefits. So, when we talk about therapy, and I'm just going to say therapy and not psychotherapy for the rest of this. You know what therapy I'm talking about. There are a lot of different people or professions that provide therapy. I'm going to name them and kind of come back to them and lump a few together. You have your licensed mental LMFTs, licensed marriage and family therapist, licensed clinical social worker, licensed professional counselor, psychologist, psychiatrists, and we're going to talk about life coaches just a second as well. So, what are they? So, your licensed marriage and family therapist, your licensed clinical social worker, and your licensed professional counselors are all therapists, master's level therapists. So, what are they? What is their role? What's their function? Their function is in helping the client get the big picture, helping you discuss your feelings and address them in a constructive way. So you have all this stuff going on. So you go to therapy with a therapist to say, okay, I'm not getting it. Life is a little stressful. I need some help. They also help with, they are the ones who provide talk therapy. We're going to talk about some techniques in a minute. So therapists focus on the big picture. Therapists are not necessarily the ones, depends on what state you're in Texas, who are going to diagnose you with a serious mental illness. That would be a psychologist. Psychologists can either be a PhD psychologist or a PsyD psychologist. Both are doctoral level practitioners. And they can diagnose the mental illness based on observation, surveys, tests. That's what they do. They can research your condition and provide treatment and recommendations. They also do talk therapy, and they're there to help with your condition. Some definitions say that your psychologists are more research based and your therapists are more practical, yet they're all supposedly evidence based. And then you have a psychiatrist. A psychiatrist is a medical doctor. What do? They're the ones that can provide the medicine. No one else that I mentioned has the ability to provide any medication. Now, when we think about psychotherapy and we think about medicine, sometimes you need both. There are people who can come and they can deal with just psychotherapy, they can deal with talk therapy, and they can work it through and they can talk it through and they get an understanding of it. There are some people, they can talk to their blue in the face. They need that medication. And I always like to say, when it comes to medication, when it comes to mental health medication, people are like, oh no, we can't do that. If you look at it like I do, is it's just part of your health. Health is health. Mental health is your health. You would take medicine for a headache. I use a headache because I have a screaming headache right now. When this is over, I am going to go take something for this headache. If you were diabetic and needed to take medicine or needed to take insulin, you're probably going to take it because you understand, even if you don't take it regularly and have some issues, you'll take it enough. People with high blood pressure will take it. People who have cancer will often go through treatment. Now they go through treatment sometimes and say, I can't do it anymore. But man, they've tried it. So people are willing to try medication for anything except for mental health. And if you look at it as just part of your health, it doesn't mean there's a weakness in you. So the thought is if you're depressed, there's something wrong with you. Yeah, you're depressed. But it's nothing wrong with you because you are depressed because you became depressed. No, that is the mental health issue that you're faced with. So when you think about it, why not? But it is a psychiatrist who you will deal with to manage that medication. They are trained and they are medical professionals. They are a medical doctor, and their specialty is psychiatry. So they know about the body, they know about the brain, they know how these medications can impact you. They study the medications. But when it comes to saying, well, I don't want to take it because, I need to be able to handle it by myself. Could you handle your diabetes by yourself? If you're a person who suffered migraines, can you handle them by yourself? If meditation and quietness and mindfulness doesn't work, are you going to finally take a pill for that medication for that headache? Probably so. So you don't have to say that, I can do this on my own. There's nothing wrong with me. Yeah, it's something wrong. The something wrong is there's a mental illness that can be treated. So that's where your psychiatrist comes in. But your licensed marriage and family therapists, LMFTs, your licensed clinical social workers, your LCSW, your licensed professional counselors, LPCs, and your psychiatrist are there to to treat whatever is going on. Your psychiatrists are the ones who can do the testing. They can, if if you feel like you have ADHD or autism or your child has any of these, that's who you're going to go to, is the psychiatrist. I'm sorry, the psychologist to do the testing. They're the ones that can officially say, this is what's going on with you. So they're important. Once you receive that diagnosis, you may stay with a psychiatrist, you may stay with a psychologist, or you may work with a therapist. You may decide. So when it comes to deciding, one of the things to look at is and we'll talk about this in a little bit. How do you decide? And you want to look at not just their license, but that individual person's expertise. So what do they specialize in? Um, it may be that you have a choice between a psychologist and a therapist, but the therapist you're looking at has training in the area that you need. They specialize in that, and the psychologist doesn't. So although the psychologist is a higher level practitioner, you want to look as well at the what are they trained in? What is their specialty? So you decide, okay, maybe I think I need therapy. Haven't figured out who I'm going to yet, but what's going to happen when I get there? What do they do? They're all trained, but how do they help me? So there are different models. There are a lot out there. I'm only going to look at a few just to give you an idea of what process the therapist might use, regardless of their training. One is CBT, Cognitive Behavioral Therapy. Nice big name, isn't it? This helps people identify changes in thinking and behavior patterns that are harmful or ineffective, replacing them with more accurate thoughts and functional behaviors. Nice big definition. CBT takes your irrational, illogical thoughts and replaces them with rational, logical ones through the therapeutic process. Um, you will have, excuse me, when you're dealing with CBT, It's the kind of therapy that you have homework in. So you're going to uh, have time in your session, and the practitioner, the therapist, is going to send you home with something to do. The idea is that it's going to help you have those real world experiences. Then you come back and talk about it. Now, therapeutic homework can be some of anything if you've never been. So let's say you're a person that is struggling with organization. Your therapeutic homework might be to clean out one half of your closet. You think, how does that sound therapeutic? Well, if that disorder is bothering you and causing you angst, that's something you would deal with in therapy. It might be if you're dealing with someone who has issues or they almost agoraphobic, they just don't want to go outside, they're afraid. Your homework might be walk to the end of your driveway and come back in, which might eventually progress to drive to the store. Don't get out, drive there, sit in the parking lot, and come back home. The next one might be now go in the store. And it might be go in, stay 5 minutes, and come out. Those are some gradual steps you might use with a person to get them used to just whatever their issue is. So those are types of homeworks, but it's designed to change your behavior. So if you think about it, if you hadn't been out of your house, and this happened with several people during COVID who were already had some issues going out, and now it's COVID and you can't get out, yeah, going to the end of your driveway is a major accomplishment. So CBT can, be large things, small things, but it is designed to change your thinking, designed to change your behavior in gradual steps. And then there's interpersonal therapy. This is a short-term therapy. It helps patients understand underlying interpersonal issues that are troublesome, like unresolved grief, changes in your social world, conflicts with significant others. Um, it helps people learn healthy ways to express emotions and ways to improve communication. And that is a big thing you find people coming into therapy. Communication. You find it in couples, as I said earlier. You find it just people who have communication issues. And that is why they may come. DBT, you hear people talk about. So I wanted to get some of the ones you may have heard of. It was dialectical behavioral therapy. Now, it is a specific form of CBT that I talked about earlier. Um, it is a very specific form of it, of the cognitive behavioral therapy. Now, what this does, it helps regulate emotions. It's used to treat people with chronic suicidal thoughts, people with borderline personality disorder, people with eating disorder, PTSD, post traumatic stress disorder, and it teaches new skills to help people take personal responsibility to change unhealthy or disruptive behaviors. It can be individual, it involves individual and group therapy. But again, it is to help you take responsibility to change those unhealthy behaviors. And remember, cognitive behavioral therapy, the other one, is about looking at whatever isn't working and finding whatever those thoughts are that really aren't beneficial and changing those thoughts. That's what this is more specific, more targeted, and different populations. Psychoanalyst, when you think about Freud, that would be the psychoanalyst. Then there are there is one solution focused where you're coming in and it is a short term therapy, not meant to be long term. This is the problem we're going to do. We're not going to talk about what happened in your past. We're not going to talk about now. This is the problem. We're going to deal with the problem. We're going to focus on it and come up with a solution. It is solution focused. There are other types that are more creative that are used in conjunction with some of these, and that is your creative arts therapy, music therapy, expressive arts therapy, dance therapy, poetry therapy, writing therapy. There are specific trainings you do to use the arts in therapy. My initial major in undergrad was music therapy. Didn't know years later I'd actually become a therapist when I changed my major from that. But yeah, music therapy, art therapy, dance therapy are all ways. And then when you have children, there's play therapy. You might not realize, but very young children can be involved in therapy. 2 year olds, you're like, okay, a 2 year old's not even talking. But in play therapy, the idea behind play therapy is that play is the natural language for children. So that as a play therapist, and I've taken all but one class to be, licensed as a play therapist, but so I've got some training there. And the idea is that as you observe their play, you can tell what's going on. They're going to act it out in their play. The easiest example I can give, once working with a client, a child, and they come into the playroom and they just get to play. And I'm sitting back and I'm observing, and you make comments like, depending, there are different forms of play therapy, but so you might just comment on, you're playing with the doll now. Very non judgmental. You're acknowledging that you're there. So this child was about 5. I had one of the Bobo dolls. That's the one you hit and it pops back up. You hit and it pops back up. So he hit it and it popped back up. He hit it and it popped back up. He sat on it and he hit it and hit it and hit it. He called it the name of someone he knew. And he hit it and hit it and hit it. He hit it so much, he destroyed it. Yeah, he beat up the Bobo doll. But guess what? When he did, he said, they're gone and they can't hurt me anymore. And there was a total difference in his behavior after that. He was able to work it out. So his was a matter of he worked it out. Play therapy can be used with children who are sexually abused. If you have some doubt, there's some things you look at as a play and you're like, certain things you will see as a play therapist, you're trained to look at it. So that's another form of therapy, and how younger people can be involved in therapy. Play therapy can be utilized with older kids. I have clients that I have played games with, because just talking, like, an 8, 9, 10 year old, just talking for 45 minutes to an hour is, I want to talk that long about stuff going on. No, they don't want to do that. But boy, we'll play a game and we'll talk about the game. We will, I'll challenge them. Or I'm using CBT and they have homework. If you do whatever homework, therapeutic homework is, if you do it, I will, let's see, if you do your homework, then we can play such and such a game. And when I play games with kids in therapy, I play to win. I will tell them, I'm not trying. I don't care that you're a kid. I will beat you. I'm trying hard. There's some games they play that I cannot win. But and sometimes you want children to learn to lose because that's part of their issue. So you choose a game where, yeah, you really are going to beat them, and you have to manage their emotions about losing. So there can be a lot of therapeutic value in playing games. I have a therapeutic form of Uno. Every time you pull a certain color, you have to answer a certain category of questions. I did it once with a family, and they actually had a breakthrough at that session because I switched it up, and they were able to ask each other, whoever the person pulled that card, let's say it was blue, everyone could ask a question out of the blue category. And you had to be honest. And they were. And they had lots of breakthroughs. And we ended up putting the cards down, and they were just able to talk. But it started out because they were playing a game. So the play at any age can be a medium to help people distract from the thought of, I'm in therapy and it's scary. So the play can be beneficial. There's also, I wanted to mention animal assisted therapy. Working with dogs, horses, and other animals can bring comfort to a lot of people. So there's also one I forgot the exact name, but it's basically like agricultural therapy, planting, working in the dirt. There is a lot of benefit to working in the dirt, being one with nature. And some people can really get lost in that time of just being with nature and being out there, and you're watching something grow. You're creating something, just like you are with, arts and creative arts therapy. Um, when you talk about therapy, like I said, I'm going to talk cost in a minute, but just looking at all of the different types, all of the things that it entails, my purpose is to make this a little less scary. Your therapists are just everyday, ordinary people like you, and many therapists are in therapy too. Many psychologists, many psychiatrists, they're all in therapy too. We value our profession, know the benefit of it, and we go to therapy too. I'm looking for one now. It's just a part of the world we live in, and our world has gotten more and more complicated. And as it does, the need for therapy increases. The need to realize, wow, I need some help managing life, and there are people who are trained to help me manage life. That's what we do. So, what does it cost? If I have convinced you that this is something you might want to try, now you're like, okay, but can I afford it? Well, not everybody has insurance. I spent many years without it, working for myself. And then now I'm like, okay, you too old for that. But if you do have insurance, we'll start there. Most insurances have some type of mental health. It will say mental health, behavioral health component. They're going to pay something. The better the insurance, the better the mental health coverage, the better the medical health coverage. So there's going to be some type of benefit you have. Jobs also have what they have called an EAP, Employee Assistance Program. One of the things that the EAP covers is sessions for mental health. So if you have EAP, you might get 5 sessions, 3 sessions, 8 sessions, 10 sessions. It depends on the company. Some might be 5 over a course of a year. Some could be eight sessions per incident. So you could be, I'm going because I'm depressed. I get 8 sessions for depression. I'm going now because I have anxiety. You get 8 sessions for anxiety. I'm going now because I'm dealing with grief. And you could stack them up. So it really just depends. So if you have insurance or if you have an employer, check out the EAP program, check out your insurance, see what your copay is. Maybe you only can afford a few sessions, but maybe that's going to be what it takes to get you what you need. Um, we'll talk a little more about just finding that therapist. There are community health clinics. There are things like in Texas, there's still in the Dallas area, mental MHMRA, Mental Health Mental Retardation Association. Houston, Harris County area, the name has changed. I cannot remember the name, but there are different county agencies that help with mental health. If there are severe issues, your major cities are going to have a county hospital that will help you deal with your mental health. So there are a lot of different county agencies. It's just finding them. And then it's like, okay, I don't know where to start. So I went to look on websites to find. And you want to get reputable websites. So I went to SAMHSA. SAMHSA is Substance Abuse and Mental Health Services Administration, a government agency. If you go to SAMHSA, SAMHSA, and again, it stands for Substance Abuse and Mental Health Services Administration. If you look at it, number one, they have a 24-hour hotline. But you can go and search on their website, and you can find a place where you can search for mental health providers. They have an 800 number, and it's 800-662-HELP or 800-662-4357. And you can actually speak with someone to say, okay, I'm having these issues. I need help finding someone, and they can help you navigate the system. There is findhelp.org. That is another one. And on those, there are you might be able to find low cost help for yourself, but those are government websites that deal with mental health. I found another program as I was searching, and it's called Open Path Psychotherapy Collective. It's a national network for mental health professionals who charge between $30 and $80 per session. Unlike more extensive mental health directories, this website only includes people who will take a sliding scale. um, so that's a really cool one. Open Path Psychotherapy Collective. Really cool because people can go there and they work on a sliding scale as low as $30 an hour. And yes, that still may be cost prohibitive for some people, but man, it puts a lot of more people in the range of being able to get help. Open Path Psychotherapy Collective. So, how do you find a therapist? How do you find a psychotherapist? Do you want an LMFT, licensed marriage and family therapist? Do you want a clinical social worker? Do you want a licensed professional counselor? Do you want a psychologist? Do you want a psychiatrist because you need to have medication? So you can look into them a little more. Then you can go to websites such as Psychology Today. I'm mentioning that one because you can type in specifics you want. I like it because you can go in, they have a filter. You can say, I'm looking for an African American female between the ages of 30 and 50 for my therapist, if that is what you want, and I have this insurance. You can literally just type that in the filters. There's a filter for this, a filter for gender, a filter for ethnicity, a filter for age, a filter for insurance. You can filter that and your zip code. So it will give you people within whatever radius you choose who meet your qualifications. Now it's going to come up with your LMFTs, your social workers, your LPCs, your psychiatrists, your psychologists rather, will all be there. Then you get to read their profiles. Some people have a video. It's a 30-second video. You can listen to what they have to say and hear their voice. Maybe you're like, oh, I can't listen to that voice. I'm not going to them just because I don't like that. Okay, that could actually be your issue. But you read their profile. You read the things that they specialize in and see, do they treat something that I'm dealing with? If not, that's not the one for you. If they specialize in youth and adolescents and children and you 40 years old, they're not the one for you. If you're looking for help for your 8-year-old and they don't say they work with children, they're not the one for you. So there are other ways to find therapists as well. Recently, especially in the pandemic, lots of online therapy platforms have popped up. You see commercials for better help, and I'm not advocating for any of them. I'm just saying these are some I've seen. Sondermind, Ally, lots of different, depending on what part of the country you're in, which ones you'll see. But there are lots of different online um, means, and you can type in online therapy. They accept your insurance, they accept private pay. There are different ways they pay, different fee structures. So that's another way. But when it comes down to it, it's about making the decision to say, I'm not well when it comes to mental health. Doesn't mean that I'm a bad person. Doesn't mean that I'm not spiritual enough. I didn't mention that, but I will. It doesn't mean you just need to pray more. Do you just need to pray more if it's diabetes? Yes, you need to pray more, but that's not that doesn't negate going to a doctor if you're physically ill, nor does it negate going to see a mental health professional. So as you're looking for a psychotherapist, as I said, there are government websites. You could just type in need a therapist in my area. There are things like Psychology Today, therapist find. So many ways. Then find somebody you know. Reach out to me. As I said, I don't have to be, I'm not trying to be the whole world's therapist. If I am not the therapist for you, I will definitely help you find one. People have come to me and I have said, are you sure? I've had males come and I'm like, do you want a male therapist? I will help you find one if you feel more comfortable. Nah, I'm good. Or yeah, I think that'll work. Cool. But be able to get the help you need. It's okay. Doesn't mean you're a bad person, something's wrong with you internally, you're less spiritual. It just means there's an area of your health that needs some help. So tonight's goal was just to sort of demystify psychotherapy. So if it's not you, maybe you can share it with someone else and say, maybe it gives you some tips to say, this is what therapy is. These are the different kinds of therapies. These are the different kinds of people you might want to see. Here is where you can go. So maybe it's something you can share with someone to say, therapy's not that bad. This is all it is. So as I end, I always like to have my call to action. And so tonight's is very related to the topic. If there's an area of your mental health that's not well, get help. It's okay. There are different type of therapists, master's level, PhD level, and if there's medication needed, there's a psychiatrist. Get the help you need. If it's not you, encourage someone you know. Instead of that family member, that's just so and so. They, they look crazy. Maybe they need some help. Or maybe there's lots of hurt issues and PTSD issues from the past that they need to heal from. So instead of dismissing them, maybe they need help. So encourage those who need it. Always be an educated voter. Why do I always say this every week? The laws that are passed impact our lives. There are laws that can impact your mental health, physical health, whether we ban certain things, whether we allow certain things, whether the government in your state wants to take federal money for mental and physical health, whatever. So many things that are voted on by the people you elect impact your mental health. So, yes, be an educated voter. COVID's still here. Do what you need to stay safe. Be careful. Washing hands is never a bad idea. Being in crowds of people, maybe not such a good idea. But take care of your physical and mental health. You're the only one you have, so take care of you. I am Bronwyn Lucas with Able Counseling and Consulting. Reach out if you need help, and I will see you next week.